Hi everyone, I'm Jennifer Blevin Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today is a patient-centered video, and we are going to talk about patients' rights. I get a lot of questions from people kind of off and on about what their rights are as a patient when it comes to healthcare. And there are a lot of them, but I'm just going to try to hit and highlight the big parts that a lot of people might not understand or not realize. And I wanted to empower my viewers to know that as a patient, you have a lot of power and you have a lot of rights. And if you don't advocate for yourself, unfortunately, probably no one else really is. So I want you to feel comfortable advocating for yourself by knowing these things. So make sure you watch until the end because I'm going to go over all of the really important ones that, as someone who works on the other side of healthcare and has been a patient herself, that people need to be aware of. The first one is you can choose who you want to see when it comes to doctors, labs, diagnostic imaging. All doctors are used to giving referrals or suggestions on where they think you should go, which specialists you should see in the area, which diagnostic imaging place to go to for your mammogram, who they're sending your blood work to. But you do have a right and say into that. So if it's someone that you've seen before or a family member has seen before and they didn't care for them and you don't want to go see them, you don't need to. If it's too far away for you and you don't want to drive that far, that's okay. You don't have to. But do know that if your doctor or whoever is referring you to this specific place doesn't have an alternative in an area that's more convenient for you, or a different specialist that they're not familiar with. Maybe they've never sent patients to a doctor you're looking at going to see, so they can't really speak firsthand about how they treat patients. That's okay. You just have to be aware that you're making that decision based off your preference. Before you get, all excited to go see someone, you do want to make sure that they accept your insurance and the specific plan that you hold with the insurance, because maybe you have an HMO plan and they don't take the HMO plan, they only take the PPO plan or something like that. So you might need to do your own footwork, your own diligence, and call these places and explain to them that your primary care or someone wants you to see that kind of specialist or go have a certain test done, and you want to go to them, and then you just need to ask them if they accept your insurance and your plan. And they should be able to tell you. If not, call your insurance. They will be able to tell you. Okay, so you don't have to see and go to the places that your doctor is telling you to go. You can go wherever you would like, but they usually refer to places that they have seen good results with. They've gotten a lot of positive reviews from other patients that have been there, things like that. Okay. The second thing is you don't have to have the treatments and do anything that your doctor tells you you have to do. Now, let me put this out there that I'm not telling you to go against doctor's advice. That is not my point here. My point here is that it's okay to take time to think about things. It's okay to do your own research. It's okay to ask them about some other alternative that you've read about or heard about and ask them their opinion about it. I'm not saying to not listen to them or not do what they say, but it's okay to think outside the box. It's okay to let them know that you want to think about it for a certain amount of time, or that you're going to do your own research or ask them questions about the research you've done. You don't just have to blindly follow. You have to do things with what you're comfortable with. And they did go to school. This is their specialty, and they are supposed to be doing the best for you, and they always have that intent for you. However, you have to be comfortable with it. So it's okay to question your doctors in a nice way, or ask if there's an alternative or another way, or maybe try something for a short amount of time. And if there's not really positive results, maybe you could, then try what the doctor is suggesting. I don't know. I just want to let you know that it's your right to not have to do what they say. You just need to make the best decision for you based on informed consent. Okay. The third thing is you do not have to bill your insurance for your visits. Now, if you're a Medicare patient, that's a little bit more difficult. If you're a Medicaid patient, that's a little bit more difficult. If you are a commercial patient, however, that is pretty easy. If you don't want something billed to insurance, let's say you're going to the doctor and you're having a pregnancy test and you don't want your insurance to know about it, you can ask them to not bill insurance and you would be expected to pay their cash rate and you would be expected to pay at the time of service. However, they have to honor your request at not billing the insurance company. So, not everything you do has to be billed to your insurance. That same thing goes for prescriptions. There are a lot of places like Kroger, Walmart, Costco probably even has something where they have a drug savings program that you can enroll, and it's cheaper to pay cash for certain medications than going through your insurance company. And I know that sounds crazy because the whole purpose, we all think, to have insurance is to make things more affordable, but unfortunately, that's not the way things are anymore. So, if you like, I am on a medication for my allergies and my asthma, and it's super cheap to pay out of pocket. I get 90 days and I don't even go through my insurance. Now, I don't get the credit towards my deductible for doing that, but I don't really care because it's not that much money anyway, and I never hit my deductible anyway. So it's not that big of a deal. It's a decision I have made as a consumer and as a patient. But because it's so cheap to get 90 days and it's a lot easier than going through my insurance, that's how I do it. And a lot of people, when I was a medical assistant, didn't realize they could get a 90-day supply of their levothyroxine for $12 when they had to pay $15 for a generic 90-day copay. And they're like, I go, you could go and pay cash $12. And they go, what? I don't have to use my insurance? I don't have to pay $15? I saved $3? Yeah, you don't have to use your insurance. You could save that $3. And they're like, oh my gosh, thank you so much. So a lot of people are not aware you don't have to use your insurance if it's cheaper and more affordable for you to pay cash. Now, again, Medicare, it's a little bit more of a slippery slope. Medicaid, because they are government insurances, there are certain guidelines that we have to follow as far as being on the clinic side and the billing side. There are some documents you could sign that says, I want this to be a self-pay, and you sign it before services are rendered and they tell you how much it's going to be. It's called an ABN form for Medicare patients. There's certain times that we can do that. However, usually if you have insurance, you have to use it. But commercial payers, especially patients that have commercial insurances, you should be fine. The other thing that you need to be aware of is that you have a right to see your medical records. And nowadays, it's not as big of a deal because you have patient portals and everything is released to your patient portal. And you can look at your lab results, your test results, your documentation, progress notes from doctors, and that's all well and good. But a lot of people don't want access to their portals, or they just think it's a hassle, or the older generation has trouble using their portal. And I encourage everyone to get access to their portals so that they can review chart notes. Because if there's something in there that you're not agreeing with, or that they mention that might be inaccurate mostly, you can contact the doctor and ask for them to addend that progress note. Now, there are some hoops that you may have to jump through, because if it's something where it is something the doctor has diagnosed and you don't agree with it, like maybe they have said that they have diagnosed you with depression and you don't think you're depressed and you want it taken out, that's a whole nother deal. And I don't recommend that, to be honest with you, because doctors are trained, and sometimes we don't like to hear things that are hard to hear. And so you might not be happy to see that, but if you really were to do a deep self-reflection and take the emotion out of it, you probably are depressed, right? And it probably should be documented. So you need to be sure that when you're looking at these notes, you're being very objective. However, if they said maybe that your mom died of breast cancer when she was 35 and she was actually 45 or 50. Now that is something that should be corrected because that can make a big difference on treatment plans and for yourself and early detection, right? So something like that I think is very appropriate for you to ask for them to make the change, and you can request that. However, I do think still looking over your progress notes, your imaging results, your lab results, having copies of those is very important, and you should be actively involved in your health and you should be looking those over. When we had old school paper charts, this was way more applicable, of course, because, nobody could see anything because it was all paper stored in the doctor's office. But now with technology, it's beautiful. So it's one of those things, though. You do have the right to view your progress notes, and if you have a question about something or you want something addended, you can have that discussion with your provider. You might not have that honored, but you can at least have that conversation about the change request for your chart note with your provider. Okay. So you have a lot more rights, but again, I could go on all day, but these are some of the biggest ones that I really want you to know about, that you don't have to bill your insurance if you don't want to. You can pay cash. You have a right to look at your chart notes. You have a right to choose who you see and who treats you. You have a right to question treatment plans and care plans, things like that. And it's only yourself that can advocate for yourself. And you can change doctors anytime. If you don't like a doctor because you don't feel comfortable with them, then change. You want to feel comfortable. You have to feel trusted, and it has to be a mutual thing. And that is one of those things that you're only going to know yourself. If you know your rights and you can advocate for yourself, that is the first step. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your family and friends who you feel would benefit. I appreciate the support, and we'll see you next time. Bye-bye.